In this lecture, we're going to be looking at managing risk with legal and ethical considerations. Specifically, this lecture is going to focus on culturally appropriate care. So, of course, anytime we talk about working with individuals, we have to consider how we can most competently treat those clients. And now we know that a huge part of social work is being able to provide culturally competent services to individuals seeking treatment with us. So to kind of address this issue, we first need to start by just understanding what culturally appropriate care really means. So when we think about culturally appropriate care, some of the thoughts that my students usually kind of have when we address this issue are things like, looking at an individual's racial and ethnic background and seeing how maybe specific racial and ethnic norms or practices might impact the client-clinician relationship. Another common idea of culturally appropriate care when I talk to my students is they think about the concept of providing care within the context of someone's spiritual and religious needs. In addition to this idea of racial and ethnic makeup, spiritual background, we also need to consider an individual's cultural in terms of how comfortable they may be in utilizing telehealth services. So when we look at an individual and we work with an individual, one of the things, in addition to kind of learning their background information, would be to learning how comfortable they are in utilizing technological services. Now, a lot of times this is going to be impacted by things like age and socioeconomic status. And this of course is a very general response or general approach to working with different types of clients. But more often, I would say, older clients have more trouble with telehealth service than younger clients do, for the pure fact that younger clients are typically brought up or grew up with more technologies. So in working with an older client, for example, we need to recognize that they might not be as comfortable and familiar with technology. So we would need to make sure that in working with them, we address that maybe cultural uniqueness by providing them with extra training, for example, on how to utilize services, maybe setting them up with someone who can actually come to the house the first time to teach them how to access services online. When we think about providing culturally appropriate care, it's also important to think about the varied population that we would see in telehealth provision of services, specifically the veteran population. Since veterans are the population that are using telehealth services right now more than any other population, understanding that no veteran or no two veterans are exactly identical, and that they all really are very different in terms of their backgrounds is the most important thing to understand. So when we work with clients, particularly with veterans, making sure that we're assessing not only who they are with their background, but also their comfort level and their ability to access care using telehealth is where we typically begin by promoting culturally appropriate treatment. Kind of in moving along, looking at how we would assess someone to understand their cultural identity and how that could play a role in the client-clinician interaction, we first have to understand that the client defines his or her own identity. It's up to the client to give us the information that they choose to give us, and we never would want to either incorrectly project or stereotype our beliefs of a certain population onto someone. Therefore, it's crucial that we allow the client to kind of identify themselves in their own cultural and personal identities. Again, I've kind of addressed different comfort levels with video conferencing and other technologies. This will be an important part of assessing and understanding an individual and where they're coming from. When we think about provider-client interactions and how we can be the most sort of culturally competent when we're actually interacting with our patients, we need to understand that verbal and nonverbal communication is something that's definitely going to have to be addressed. Certain people are more comfortable with direct communication, where other clients are going to need a little bit more softer delivery. This really is an issue of understanding what types of communications are generally the best with certain types of individuals, but then also really asking that individual, maybe straight out or in the assessment piece, what types of communication styles are you more comfortable with? We want to make sure that we're addressing our clients as unique individuals while taking their cultural and personal identity into fact. Establishing trust is another kind of interaction that is really important in the telehealth environment. Certain populations, certain cultures are just less kind of attuned to being able to establish trust really quickly. If you think someone who hasn't grown up with social media, someone who hasn't grown up with technology, someone who is from a culture that's maybe a little bit more distrusting of authority figures, you would need to work extra hard as the clinician to establish this trust. Trust is already difficult to establish in an online environment, so working even harder to building rapport with clients in this type of online arena is particularly vital to providing culturally competent services to our clients. In understanding that everyone has this sort of unique identity, of course, it's important to recognize that some clients are going to be from urban settings where other clients will be from rural settings. There are typically certain norms and practices that go along with living in specific communities. So again, addressing these types of issues is really crucial in making sure that your interactions go as smoothly as possible. Last, making sure that we're providing culturally appropriate care in terms of service care planning is something that we really need to focus on. So, of course, in social work, it's our belief that we need to work collaboratively with clients. In telehealth, there is no difference. We have to work cooperatively to develop action plans just as if the client was sitting in our office in a face-to-face environment. We also need to make sure that we're working competently and professionally with other telehealth service providers. The idea being that typically when a client comes to see us, or often I guess when a client comes to see us, they have more needs than just what we can match. So being able to connect with other telehealth service providers will allow us to, again, work more cooperatively and collaboratively with everyone to reach kind of the best results.